So peace, everyone, and welcome to the Village. My name is Shaeja Medina, and I am the director of this space. And just quickly wanted to introduce everyone to the Village and just speak quickly about why it's important that we were able to host this event in this space, even though it didn't rain. And so the Village is an Afrocentric cultural learning and healing center. It's a space where people in our community feel safe, but especially Black and brown folks. And for us, there has been many historical implications to the ways that Black women's bodies, Black bodies, babies have been treated in our country and in our world. Contemporarily, we know that there are challenges. It's something that's close to our family in a very personal way as well. And as a community center, we just feel like if something's happening that's gonna be impacting our community and disproportionately Black and brown women and children and families, we are always honored that people feel like that can be held in this space. And so I just want to thank everyone for seeing the light in this space and feeling like this can hold this important work that everyone is bringing this afternoon. And thank y'all for letting me share a little bit about the Village in this space. And thank you.
Good afternoon. Thank you to the Village for hosting us. I am Natalie Higgins. I'm the state representative from Leominster, and I'm joined with Meg Kilcoyne.
Hello, everybody. My name is Meg Kilcoyne. I'm the state representative from the 12th Worcester District, just north of here, 6 communities.
And we're going to be joined by some other friends from the North Central delegation throughout this afternoon. And I am just so thrilled to be down here in Worcester with all of you. We have been fighting to save the Leominster Hospital Birthing Center since Memorial Day weekend, when we got the news that UMass Memorial Healthcare intended to close our birthing center. And I am so proud of the coalition we built and so thankful for the support of this Worcester delegation to back up that this isn't just a Leominster issue, this isn't just a North Central Mass issue, that this is an issue that impacts the entire Commonwealth. When the news broke that they were going to close, that UMass Memorial wanted to close our birthing center in Leominster, I thought, there's no way that this could actually happen. And I'm a state representative, and my community was pretty angry that this could happen to our community. And we quickly learned that over the last 10 years, 10 birthing centers across the Commonwealth have closed. In that same time, our rate of severe maternal morbidity has more than doubled. We're coming here with you today with some news. Today is the day that UMass Memorial had to respond to the Department of Public Health's request to delay the closure. It is an unprecedented move by the Department of Public Health to say, slow down, you are not ready, and this is going to hurt our community in irreparable ways. And yet we learned this morning in meeting with UMass Memorial Health leadership that they intend to move forward with the closure on September 23rd, 11 days from now. And so we are all in this together. This isn't just about North Central Mass, but this is about a maternal health care crisis across the Commonwealth and making sure that we're stepping up and protecting birthing families and making sure that they have access to care in communities and can actually get there. And so you're gonna hear from some incredible nurses from Leominster Hospital that have been leading the fight and lifting up just how incredible the work is that they do every day. They support 600 birthing families across North Central Massachusetts, the single largest provider of birthing services for our families up in North Central Mass. And we desperately need to keep this. I'm also really glad to be joined by Rep. John Zlotnick from Gardner. This is the most cohesive our delegation has ever been. I am super grateful for them backing up what is happening in my district, but impacting residents all across Central Massachusetts. So thank you for being here. And I want to introduce Tara and Amy, who have been incredible nurses from Leominster Hospital, really lifting up what this means for the patients that access care at Leominster Hospital and just how unprepared our community is to lose these services in 11 days.
Hi, my name is Amy Gagnon. I'm a registered nurse on the birthing center. The hospital is proposing to close in just 12 short days. While staffing issues do exist on the unit, what UMass Memorial Administration is telling you is far from the truth. A total of only 4 positions need to be filled for us to make our unit fully staffed. I have 4 or more postpartum nurses willing to take these positions. These 4 nurses have even applied to the open positions. I have been discussing with my previous nurse manager ways to cross-train these nurses as far back as October of 2021, when I saw traveler after traveler being hired for labor and delivery after the hospital had set up a massive buyout a few years prior and paid 12 senior nurses to leave. I offered to work extra to cross-train these four nurses. We were told no, nurses would have to train on the day shift when the need was for the night shift. Yet nurses hired to other units in the hospital are allowed to train on the night shift. I have an email dated 11/4/22 that I had sent to my nurse manager stating, "Hi Deb, I'm hearing 2 postpartum nurses applied for nights, labor and delivery. I'll be more than willing to work extra to get them both trained on nights and work beside them till they feel fully competent enough. Since we have so many travelers, why don't you put the travelers on postpartum so I can train regular staff, Amy." Our then nurse manager was let go shortly after she left management. With the help of our nurse educator, logged on to JobBite, which is our system for applying for a job, and she pulled up over 20 applications of experienced nurses. Our nurse educator voiced to her that she was willing to call each one of the applicants. The applications were then ripped from her hand, and she was told, "No, you will not." All of this was witnessed by our scrub tech. The staffing issues with the OBs that you hear of, that they speak of all the time recently, have been resolved. All 3 practices have merged call time, and providers are now required to do less call time than they were previously doing. One OB stating recently, "I don't know why we didn't think to do this sooner." Please understand that the workforce challenges throughout the healthcare sector are real. However, UMass Memorial's efforts to hire for staff positions at our birthing center were neither exhausted nor made in good faith, as witnessed firsthand by myself.
My name is Tara Corey, and I have been a nurse at Leominster Hospital for the past 8 years. I am saddened that we have been fighting this fight for 108 days now, with only 12 days left to go, and I would like to discuss the impact that this closure will undoubtedly have on our patients and our community. Mothers deserve a safe place to give birth to their babies, and babies deserve a place designated for them to come into this world. Babies should not be born in emergency rooms, in ambulances, or in cars on the side of the highway. We recently had a mother go public with her story regarding her experience on our unit. She was so grateful to be able to choose a close-to-home hospital to schedule an induction for her baby. While in labor, she suffered one of the biggest obstetrical emergencies imaginable, a uterine rupture. Our trained team was able to save her and her baby's lives. She credits Leominster Hospital Birthing Center, stating she would not have chosen to undergo an induction had it not been close to home, and therefore would have been in labor at home and then driving for over 30 minutes, where her uterus would have ruptured and she and her baby would have died. We also frequently see mothers coming onto our unit and delivering in under 20 minutes of their arrival. Again, our trained nursing staff, along with the readily available obstetricians and pediatricians, have been able to provide a safe environment in which we are prepared for these quick deliveries and able to save lives every day. The argument that our birth rates have been declining within the hospital, although a seemingly orchestrated plan by upper management, does not speak to the fact that every life matters. One fetal or maternal death that will undoubtedly occur if this closure proceeds is too many. Myself, along with all of my nursing colleagues, have been fighting for our community and our patients for 4 long months. We are fully prepared to continue working at the Leominster Hospital Birthing Center beyond September 23rd. We are committed to bringing more new lives into the world in a safe, mother-baby focused unit that our community deserves. We are asking the governor and the Department of Public Health to stop this callous plan from proceeding and to please help us leave labor in Leominster.
Thank you so much for that. I certainly could not have said it better myself. And I'm Robin Kennedy, State Senator from the 1st Worcester District, and I'm incredibly proud to be here in person with my colleagues from the Worcester delegation, including Senator Mike Moore, Representative David LaBeouf, Representative Dan Donahue, Representative Jim O'Day, and Representative Mary Keefe, who you'll hear from. We're here today to speak loudly and stand strongly in solidarity with our colleagues from the North Worcester County delegation. We have been standing in solidarity with them for the past several months. As was mentioned previously, and I want to re-emphasize, the statewide crisis we are in that the Massachusetts Department of Public Health has validated around maternal morbidity rates, particularly of communities of color. And it is irresponsible to take access to services and resources away at a time when that crisis is increasing. And we're here as the Worcester-based delegation representing Worcester and our surrounding communities to say that we don't think it's a better idea to bring safety concerns to Memorial Hospital, where we know we are already struggling with a capacity issue. We have sat with our nurses, we have sat with the workforce at the maternity center at Memorial Hospital, and we know that there is already a crisis here in our community when it comes to capacity. And we want to make sure that we're standing with our colleagues in the North County delegation in one voice to plead with the state, to plead with the administration, to plead with UMass to reconsider this decision, to keep the birthing center in Leominster open, to work proactively with the community to help make sure that we are addressing the rise in maternal morbidity, to reverse those trends so that across the Commonwealth, when we're talking about addressing health disparities, it's not simply words, but it's actions that we're taking. So we're proud to stand here. We're going to stand whether it's the next 11 days and much further into the future. We're going to stand with our colleagues, with our communities, as long as we need to make sure that we're having safe, accessible services everywhere in our Commonwealth. Thank you.
Good afternoon. My name is Mary Keefe. I'm the representative for the 15th Worcester. I want to thank everyone for being here today. As Senator Kennedy said, we've had long conversations with the professionals that are in this room over the past several weeks. No one knows the workplace better than the worker. No one. And so I'm really proud that we're here as the Worcester delegation to stand together. In the beginning, as it was said, we were told this is a Leominster issue. And then over time, listening to the voices of these dedicated nurses, it became clear that no, we needed to stand together as Central Massachusetts and demand that we get the resources for our moms and our babies that really are going to make for the best start of a new life. So I just want to say, as Robin said, Senator Kennedy, we're here for the next 11 days and we'll fight really hard. We don't want to see this happen, and that's our message today. Thank you.
Good afternoon. My name is Barbara LaBeouf, and I've been a nurse for 29 years with a specialty in maternity at UMass Memorial. As a registered nurse, I'm legally obligated to advocate for the safety of my patients above all else, which is why I'm here along with other nurses in our center to share our serious concerns for the safety of our patients, for that matter, for all of the families throughout Worcester County, should our employer and the state of Massachusetts allow the closure of the birthing center at Leominster Hospital. As maternity nurses, we know for birthing mothers that every minute counts, and that access to local care is the safest care. And with this closure, UMass is making a decision that will place the lives of hundreds of mothers and newborns at serious risk. When we learned about this decision at Memorial, we were shocked and outraged because we had dealt with this issue not long ago with the closure of Harrington. We were completely strapped, overwhelmed with the volume, and we struggled to meet this increased demand. Those who suffered most were those poor families who lacked the resources and access to transportation to the care they needed. There is absolutely no way our department can absorb 500 to 600 births currently served by the Leominster Center. In fact, we are barely capable of managing our current patient population given the number of patients we serve, the acuity level of the patients we care for, the length of stay, and the complex patients required for their pre- and postnatal care. It's not as simple as taking the number of deliveries in a year and dividing that by the births and coming up with an average number. We take care of some very sick moms, many with severe high blood pressure issue called preeclampsia, and other serious issues that require one-to-one constant monitoring by our staff And some of these patients after delivery are here in the hospital for upwards of a week, while we're already managing the steady flow of new deliveries that we have every day. On many days, it's simply unmanageable as we struggle to find rooms for laboring patients as well as postpartum patients. Recently, I was a charge nurse, and I had to give up 6 rooms that were meant for moms and babies to laboring patients because there was no room in the labor and delivery unit. We even had to turn a room into a makeshift triage unit and open up the back of our OR to put patients in. We have put patients in tiny rooms that don't even have a shower. We have to delay admissions from the emergency room or from other facilities, including Health Alliance Leominster, due to lack of appropriate staff, equipment, or other resources. We get constant nursing SOS texts, which is basically an emergency begging for help because we are so overloaded with the patients. Our capacity issues have negatively impacted the care we can provide. Moms coming in for inductions of labor have spent days in triage or only come in to be sent home because we have no room. Women scheduled for C-sections being repeatedly bumped for endless hours, not able to eat or drink due to other emergencies or simply no beds available. And to get through that, to experience their, backing up. We have experienced sentinel events due to these conditions, which is the most traumatic event any family, or for that matter, any nurse can endure. And to get through that, to experience the stress we have all been feeling under current conditions, to see our administration make a decision to close yet another local service and expect us once again to deal with the consequences is unacceptable and dangerous. I'd like to close my remarks here by reading some excerpts from an email that one of my colleagues wrote to our administration about these conditions just maybe 2 weeks ago. And what we see is a total disregard by our administration for our staff and by extension for our community. I love my job. I feel very fortunate to do what I do. It's getting harder and harder under these conditions. There is a hierarchy here and there is no support. Our concerns fall on deaf ears. We've expressed our concerns about patient volume, the acuity of the patient, lack of equipment, lack of space, and how unsafe our triage department is often. Nothing has changed. The only change I see is the beat down atmosphere of this is just the way it is. Accept it, and we do, and we will until we can't. Did you know that an antepartum patient's husband brought in camp chairs recently to sit on because there were no chairs in the room? We are constantly running for things or stealing from other rooms for supplies because we don't have enough for our patient volume. It's not a new problem, but it's only getting worse, and the closure of Leominster is just going to add to that. We don't have the tools to do our job safely, and it's terrible to feel like you're giving suboptimal care when all you want to do is give your best to the patient in the safest birthing experience. Our floor is broken. We feel defeated. We need help and we need support. And as this nurse and our patients continue to struggle, and now we face the prospect, despite our voices, of our sister nurses at the Leominster Birthing Center, despite the voices of the legislatures, the finding of DPH, the urging of the March of Dimes, and the NAACP, that this administration wants to add further insult to this ongoing injury. We're here to raise our voices among all these here to sound the alarm that if the state allows this closure, it's going to put every birthing family in this entire county at risk.
Hello and good afternoon. My name is Irene Erba Hernandez. Bibi Mucaro is my indigenous Taino name. I am the co-chair to Community United to Save Labor and Delivery. I'm here on behalf of the other co-chair, Ladia Romero, who wasn't able to attend, but she's here with us. We are here with one another. We are a community, we are the tribe. And I say that UMass doesn't get to close their doors, they don't get to close Leominster Labor and Delivery. There's plenty of beds, there's plenty of room. It doesn't get to be like this in UMass. So I thank you so much for allowing us to come here today, especially with what's going on. My heart is so hurt. Since the beginning, we have been working with legislators, nurses, community to stop the hospital from closing the birthing center in Leominster. We understand the impact that the closure will have on some of our most vulnerable populations, our community members, and we are here to fiercely advocate that they reverse the decision and that it maintains its doors open moving forward. This is an essential service. This is our community hospital. Almost 300 people attended the community meeting that we organized in June to voice their concern and opposition. More than 200 people packed a DPH hearing to voice the concerns and their oppositions. More than 4,000 folks, 4,000 people, and we have more, have signed the petition that is being circulated, voicing their opposition. Why doesn't the hospital understand and respect or listen to the voices of the community? UMass claims to be a community hospital, yet they never asked us. They never spoke to the community. They never did any focus groups. They never listened. They aren't and they weren't engaging our community members or our leaders. As of right now, they will continue to pursue their plan to close on the 23rd. I say not so. I don't care about those naysayers that say, oh, it's going to happen. We can't do nothing about what UMass decides to do. I believe that's a lie. It is our community dollars. We have our delegates right here. We get to fight. We get to advocate. We get to make sure that the hospital stays open. Having women and birthing people deliver in an overcrowded emergency room is not a plan. There's no safety there. Worcester is overburdened. They cannot handle the influx of hundreds of more patients and babies coming over here. Crisis. People are going to die. We will perish. In our community, in our Black and brown indigenous communities, we already see that. DPH put a report out. We know this. In central Massachusetts, it was the Ghanaian population. Now it's other brown and Black women. How can UMass sit there, the trustees, and make a decision that will cause our community to perish, that will cause death? I can understand how the hospital has more power than the state. I don't understand how they are free to do whatever they want, whenever they want, knowingly harming our community. We need DPH, we need the governor. Hey, we need Washington, D.C. here to step in and stop these closures. It doesn't get to be a trend. That's what people say, oh, it's happening. This is 10, this is number 11. It doesn't get to be the trend. It's community dollars, it's an essential service. The time to act is now, because it's not just birthing people who are going to suffer. We are all going to suffer with the lack of essential services in our area. Thank you.
Hi, everyone. My name is Chloe Schwartz. I am the Massachusetts Director of Maternal and Infant Health for March of Dimes. More importantly, I'm a lifelong Massachusetts resident. March of Dimes is an 85-year-old nonprofit organization that advocates for the health of all moms and babies. Our mission has always focused on ensuring that our most vulnerable are receiving the care and the resources that they deserve. We are living amidst a maternal and infant health crisis. A mother today is 50% more likely to die during childbirth than her own mother was 1 generation ago. Take a moment, sit with that reality, because it is nothing short of heartbreaking. And Massachusetts is no exception to this reality and the dangerous trends that we are seeing across the country. In 2018, we began reporting on the status of maternity care deserts in the United States and Puerto Rico. Maternity care deserts are counties in which access to maternity health care services is either limited or absent, such as birthing hospitals, birth centers, and obstetric providers. The presence of these deserts has been increasing every single year. Last month, we released 52 supplemental reports on maternity care deserts, one for each state, DC, and Puerto Rico. These reports represent some of the largest body of research of its kind on the state of maternity care deserts in the country, and they delve into other factors that inhibit access to maternity care. Using data available up until 2020, this report showed that more than 5.6 million women and birthing persons in the US were living in counties with no or limited access to maternity care. We did not have any official maternity care deserts in Massachusetts by 2020, but this report does not take into account the closures that have occurred since then, both foreseen and unforeseen, of which we know there have been quite a few. This report did find, however, that 5% of women and birthing persons in the Commonwealth did not have a birthing hospital within 30 minutes driving distance based on normal traffic patterns. Furthermore, 8 counties in Massachusetts, including Worcester and all of Western Massachusetts, had a high chronic health burden, which is the percent of birthing persons and women with one or more chronic health conditions. These conditions increase the likelihood of a preterm birth by 47%, necessitating an even increased higher need for timely and quality access to care. The intention of these reports is to demonstrate a dangerous trend of decreasing availability of maternity care services that is occurring alongside a rise in preterm birth, infant mortality, maternal morbidity, and maternal mortality in the United States. It is our hope that this data will be used to inform policy and practice recommendations to prevent further decreases in access to care. Thank you very much.
Good afternoon. I am Cedric Arno, delivering words from our Worcester NAACP branch president, Fred Taylor. I am here to voice NAACP Worcester's branch strong opposition to the closure of the birthing center at Leominster Hospital, the latest in a series of such closures that impact the health and safety of the most vulnerable residents of the Commonwealth, with the most tragic impact to be borne once again by Black, brown, and other low-income living in those communities. Our opposition to the closure is given more urgency with the release last month of an alarming report by the Massachusetts Department of Public Health showing a dramatic increase in the rate of serious complications and maternal child deaths from labor and delivery in our state, with Black women consistently experiencing the highest rate, more than double the rate for white non-Hispanic women. This is the very population identified by DPH as most at risk by the birthing center closures. The issue of health equity and addressing disparities in care for communities of Black, brown, and low-income residents is the major focus of both state and federal initiatives, as noted in the DPH report and the Secretary of Housing of HHSS. Healthy People 2020 and 2030 goals, and the issue of reducing disparities in maternal child health has been a focus of the NAACP for more than a decade. At the National Convention of the NAACP in Boston this year, we passed resolutions. A particular resolution in support of the maternal health disparities on a congressional level reads, "Therefore be it resolved that the NAACP advocates for the adoption of the Mom-E-Bus Act of 2021 and full funding to improve equitable birth and maternal health outcomes for Black mothers and families. We agree with our esteemed governor that we must do better to protect the health of the Commonwealth's mothers and newborns, specifically for our Black and brown residents. We therefore take this opportunity to once again call upon UMass Memorial Health and the Haley administration to work with members of the legislature to find a way to preserve this vital service. Thank you.
Okay, does anybody else want to say a few words up here? Okay. Anybody got a bit? Okay, this time we're going to conclude the press conference. I don't know if anyone has any questions from the press they'd like to raise. I have time for a couple.
So we are really grateful for the Healy administration taking an unprecedented step through the Department of Public Health to actually call upon a delay in this closure, right? This has never happened before around a proposed essential service closure. We have to do more to fix that process to make sure that we maintain all essential services in our community hospitals. But in the meantime, we think that there is a unique set of circumstances and a unique public health and safety crisis for maternal health care and infant care that the Healy administration has an opportunity and has already used some unprecedented tools to step in and try to get UMass Memorial to do the right thing. To be clear, there's an easy solution. UMass Memorial can reverse their decision and work with the community and all of these legislators to come up with a solution. They have manufactured a crisis. We have blown through every single one of their reasons that they've given to justify this closure. And we need to keep it in our community. 600 families cannot go somewhere else and find birthing services. We know our emergency department is overwhelmed. The reality is, come September 23rd, UMass is prepared to have pregnant people deliver in the ER and have no plan when there is an obstetrical emergency. They're gonna put them in an ambulance and hope that they can make it to Worcester. That is unacceptable. We are Massachusetts, and we deserve better.
Well, we still have 13 days for sure. I think it's not necessarily unprecedented, Representative Jim O'Day, that we have a pretty strong response here this afternoon from the legislative delegation. And I just would like to also add that for the past 12 years or thereabouts, there has been a Ellen Story Commission on Postpartum Depression. And there has been years and years and years of other pieces of legislation addressing exactly the issue that we're trying to certainly keep in the light today, but to do away with. We file legislation every year to try to increase the outcomes, the positive outcomes of birthing people. And each one of those pieces of legislation is focused on having a child and mother live through the birthing process. Regrettably, that still is at a level that is, I would say, unacceptable to every legislator and advocate here in this room. So we are all in this together. We really, I mean, many of the crew have been fighting, as they've reported, since Memorial Day. The fight is not over. UMass needs to continue to hear what is being stated by all of us here as legislators, and my sense is that the rest of our colleagues, now that we've clearly made this more than just about UMass, it's about people, children, families, fathers, uncles, grandparents, and I think those were a lot of people that, frankly, the governor and her team has to be concerned about. Because if we let it happen here, then it's going to happen elsewhere. And as this group has already stated, we're not interested in that. We cannot allow that to happen. So my point is, I'm not trying to duck your question. I'm saying the fight is on. The fight is on. And we believe very strongly we'll have a better answer for you and a much more positive outcome in 13 days. Thanks. Well, that's a great question. I think it's somewhat incumbent upon us. As I've mentioned, I'm sure if we were to look at some of the pieces of legislation that has been filed, I know that we have filed bills to stop closures of birthing centers. I think it was Beverly, I think the most recent one was closed, not to identify a particular town, but, we need to be able to, I suppose, put some money into those issues, right? These are incredibly important issues across the state. When we have the commission, the Postpartum Depression Commission, we have individuals from all corners of the state. We meet quarterly. I was the chair of that commission. I'm no longer the chair. I'm still a member, however. On the House side, it's Brandy Fluker Oakley, Representative Oakley, and on the Senate side, it's Senator Liz Miranda, both women of color, I might add, and who are very tenacious with their efforts around making lives better for birthing families. Thanks.
So I think that we certainly, as we've seen over the last several years, in particular during the pandemic, the governor has enormous power to intervene, whether it's to engage in conversation with the community, with the legislature, with UMass, to amplify the message of her Department of Public Health, to, at a minimum, delay the closure until we can come up with safer alternatives, but primarily to keep the birthing center open and to work with us and work with UMass. Certainly she is one of the most brilliant attorneys in our Commonwealth, and I would defer to her and her team in terms of what other legal steps that she'd be able to take. Yep.
We're really grateful as a community. Governor Healy came and checked out the labor and delivery unit last week on her own while she was in Fitchburg because she wanted to see it for herself. And so we have to keep this unit open. We need to make it better. We need to make sure that it's meeting all of the needs of the North Central community. There are 1,800 births in the region, and Leominster Hospital provides the services for the vast majority of those births. So we need to continue to grow that. We can fix this, right? Like, we don't have a staffing trouble and shut down a service. You figure that out. It is a solvable problem. And we're here ready to solve it. Speaking for myself, I want the governor to declare a maternal health care crisis and stop the closure of any other birthing centers, including Leominster Hospital, right now while we figure out what the access need is. I also know that the city of Leominster is working with a number of pregnant women who are due to give birth after September 23rd to seek an injunction of this closure. So we're trying everything that we can from our community to keep these services here serving us.
I think there's been ongoing communication. There's been ongoing, and I don't mean to speak for Leominster, there's been ongoing communications between the legislature, administration at UMass Memorial Healthcare Center. Regrettably, it hasn't moved in the direction or as far in the direction that we all think is and really, there's only one answer. Right? Keep the place open and have safe deliveries. That's the answer. And if that means UMass having to make some adjustments, maybe with people's pays in higher positions, I don't know. But we need to do something different and keep the facility open and families and children safe. That's the function. That's the plan.
We're here today because UMass Memorial declared today, in defiance of the Department of Public Health's clear ask to delay, to say that we are your licensing authority and we do not think you are prepared to close this unit under the guidelines that already exist in regulation, that they asked them to close it. I am incredibly disappointed in the leadership. We expected that UMass Memorial was actually going to care about our communities and follow the process and engage with the Department of Public Health. They have not done that. We as a delegation have been working for close to 4 months trying to get to the bottom of how did we get here, and the rationale continues to change. First, it was nurse staffing. We figured out that that wasn't true. Then it was the declining birth rate. Then they gave us data that showed the birth rate is increasing for our community. Then they said it was obstetricians, and we found out that our community has been stepping up and private practitioners have been working for 3 years to make sure that there's enough coverage in North Central Mass for all birthing families. We're doing everything that we can to keep this center alive, and I'm incredibly grateful for the coalition that has come together to say, no, we're not going to sit idly by. We are going to fight this every single day to keep this unit open.